This video is for general information only and does not replace personalized medical advice. Always speak with your GP, diabetes team, or pharmacist about your situation. Are gastroparesis-like symptoms from Ozempic reversible after stopping treatment? That's exactly what we're covering today. If you've been prescribed Ozempic for type 2 diabetes, you may have noticed some uncomfortable digestive symptoms, nausea, bloating, feeling full very quickly, or even vomiting. These can be signs that the medication is affecting how your stomach empties, and for some people this becomes a real problem. Ozempic contains a medicine called semaglutide. It works by mimicking a natural hormone called GLP-1, which helps control blood sugar after meals. One of the ways it does this is by slowing down how quickly your stomach empties into the small intestine. For most people, this effect is mild and manageable, but for some it can lead to more pronounced symptoms consistent with gastroparesis, which simply means delayed gastric emptying. It's worth noting that according to the Ozempic prescribing information, a confirmed causal link with persistent gastroparesis hasn't been formally established. That said, the symptoms are real and worth taking seriously. Gastroparesis isn't just an upset stomach. It can cause persistent nausea, vomiting, early satiety, feeling full after only a small amount of food, bloating, and abdominal discomfort. In more severe cases, it can affect your nutrition and make blood glucose levels harder to predict. So the big question, if you stop taking Ozempic, does it get better? The evidence suggests that yes, for most people, these symptoms are reversible once the medication is stopped. Semaglutide has a half-life of around 1 week, meaning it takes roughly 4 to 5 weeks to be substantially cleared from your system. As drug levels decline, the effect on gastric motility also diminishes, and many people find that symptom recovery begins during this clearance period. That said, recovery timelines vary from person to person. If you have pre-existing diabetic neuropathy, nerve damage related to diabetes, or an underlying gastric motility disorder, your recovery may take longer or symptoms may not fully resolve. This is something worth discussing openly with your doctor. It's also worth knowing that the gastric emptying effect of Ozempic may actually reduce over time even while you're still taking it, so some people find their symptoms improve without stopping the medication entirely. If you're currently experiencing digestive symptoms, there are things you can discuss with your healthcare professional. Whether your dose or timing could be reviewed, and dietary adjustments like eating smaller, more frequent meals and avoiding high-fat or high-fiber foods. Never stop or adjust your medication without speaking to your doctor first, as Ozempic is managing your blood glucose levels. When should you seek help urgently? If you experience severe or persistent vomiting, signs of dehydration, such as feeling very thirsty, passing very little urine, or feeling dizzy, or severe abdominal pain, seek medical attention straight away. In the UK, call NHS 111 or 9999 in an emergency. For persistent nausea that isn't resolving within 24 to 48 hours, contact your GP promptly rather than waiting it out. To recap, Ozempic slows gastric emptying as part of how it works, and this can cause gastroparesis-like symptoms in some people. These symptoms are typically reversible after stopping the medication, with recovery often beginning as the drug clears your system over 4 to 5 weeks. Pre-existing nerve damage or motility conditions may affect how fully or quickly you recover. And if symptoms are severe, don't wait. Speak to a healthcare professional. Remember, this video is for general information only. Always speak to your GP, diabetes team, or pharmacist before making any changes to your medication. If you've experienced digestive side effects on Ozempic, I'd love to hear about it in the comments. And if you found this helpful, please give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.